congregation actually had its beginnings in mid-17th century France, when 6 women came together to support one another in living a life dedicated to God and the dear neighbor. In the late 1700s, France was in the grips of the Revolution. Since the sisters would not sign the oath renouncing their faith, convents were closed, properties confiscated, and most of them dispersed. Many, however, were gathered up, cast into the dungeons, and 5 were guillotined. Among those imprisoned was Sister St. John Fontbonne, who, along with a number of other sisters, had been sentenced to death. The night before this was to take place, Robespierre was defeated, the revolution ended, and those in prison were released. The sisters' reputation quickly spread. There were many poor and destitute people, and the services of the sisters were needed.
I never thought about being a sister. They were at school when I got there in the morning, and they were there when I left at night. And I never thought that you ever became a sister. I mean, they were just there, and that was that.
I think I knew I wanted to be a sister from a very young age, and it was something that I could not do. I had felt this calling from God to be of service. I just wanted to respond out of that.
I always wanted to be one of the sisters, as long as I can remember. The sisters used to come up into the country, and they'd come up and beg for the orphans. And so my parents didn't have much money, but they would send back like bushels of apples or potatoes because we lived on a farm. So I really got to know the work of the sisters and to understand some of the wonderful things they did.
If you go back to those first sisters and look at what characterized not only them, but each successive administration, you find a couple of points. You find people of great courage, people of great vision, and people who were not afraid to look at the times in which they live and say, what is it that we need to do?
Women in general in our society were not in leadership roles, and here are these women who single-handedly built one of the largest healthcare organizations in Ontario.
After the fall of Robespierre and the French Revolution, when the congregation came back together, there was a new set of needs. And when they came to Hamilton, there was a new set of needs. An epidemic, typhus and cholera.
There were a lot of immigrants at that time, and so the cholera spread very quickly.
And nobody really wanted to have anything to do with them. And so the sisters volunteered, really, to take care of them.
And so you can see today the sheds where the people were condemned to stay until they were better or until they died.
And you have to remember, in those days, there was no public health system. There were no public hospitals, that it was religious orders and orders who cared for people out of volunteerism, not a state-organized healthcare system. So the sisters really began the healthcare system in Hamilton in an organized way.
In 1861, Mother Martha and 2 of her companions made a 2.5-hour train journey to Guelph with precisely 50 cents in their pockets. And that's how St. Joseph's in Guelph was born.
And gradually, they were invited to come to different places to open hospitals to formalize taking care of the sick in different communities. In the first years of all of our healthcare institutions, the sisters lived right there in the institutions. So they worked daily side by side with doctors and other staff And so the relationship between the sisters and the hospital was very clearly visible.
These were women of grit. They were women of courage and commitment and clarity. Clarity about what they were about, taking care of residents and patients and participants and putting them first.
As healthcare became more complex and we needed to have built up our institutions so that they worked even more than they had in the past, we saw that we needed to create something whereby we could hand on to others the mission and legacy of the sisters.
I'd say the group today that has picked up that mission and run with it in a remarkable way, while everyone at St. Joe's contributes to that, at the front line, it's our nursing team. That our nurses, when you look at how they're living the mission of dignity and respect, are what day to day, hour to hour, 24/7, 365 days a year, are there for our patients.
The nurses and the staff of our institutions are fantastic. They work hard, they're great men and women, and they are very dedicated.
Being called at 3 o'clock in the morning to please come to work. The patients needed me, my peers, my colleagues needed help. Could I please come to work? And I did.
Because I'm not a nurse, but they're at it and they're there with that willing spirit to help.
What you want to do is to have good stories that people can look at, relate to, understand, and try to emulate.
Early in my career, I had a physician who was elderly and he was very sick and he required some very expensive medication. And he wondered if there was any possibility that I might go and see if the hospital would consider giving him this medication free. And Sister Paula was the administrator of the hospital at that time, and I went down to her office, explained the setup to her, and she said she didn't listen anymore, and she just picked up the phone, called the pharmacy department, and said, Dr. Sale will be down in 10 minutes for some immune globin, and I want you to give it to him whatever he asks, and replenish the supply whenever he comes back. End of conversation. And that man was kept alive with that immune globin for years.
There's so much history here about the sisters' legacy, and I think that's very special to St. Joseph's because it's very unique. It's not something that can be replicated, and the history makes staff feel very proud to work here.
And I think if our staff can realize what they do to help a person, whether it's a simple thing of helping an elderly person who needs help with her walker, or an elderly man who needs help with dressing, bathing, whatever it might be, just by being there for the person and seeing the satisfaction that comes with that thank you or I appreciate this, it's very rewarding work.